Hi everyone, welcome to Connecting the Dots. Connecting the Dots is a weekly Facebook live stream by aphasiasg. We aim to answer all your burning questions about our healthcare system and allied health services, as well as any questions you might have about brain injury and aphasia. We're basically here to help you connect the dots. I'm Evelyn. I'm the founder of aphasiasg and a speech and language therapist. I'm also your moderator for tonight. Each week, our show will feature different healthcare professionals, individuals with aphasia, or caregivers who will share their insights and experiences. For our fourth episode today, the topic is music therapy. Now, to our viewers on Facebook, we encourage you to ask questions and leave comments freely throughout the show. We will aim to answer all your questions before the end of the session. Now, without further ado, it is my honor and pleasure to welcome Michelle.
Hi, everyone. Hi, Eve.
Hi. Hey, Michelle. Good to have you.
Thank
Yes.
you.
So
Really
let me
excited.
introduce Michelle. Okay. We are really proud to have her with us today. She's an experienced music therapist, a medical music therapist working in Singapore General Hospital. She's also a neurologic music therapist fellow and serves adult patients across various medical disciplines such as rehab, neurosurgery, geriatrics, oncology, palliative, and intensive care. And she's a very passionate music therapist volunteer for Aphasia SG. Basically, she co-founded our Aphasia SG choir. Her guilty pleasures are reading, binge watching TV shows, and building Legos. Welcome, Michelle.
Yes. Thank you. Thank you for inviting me for this talk. I can't wait.
Thank you so much. Now, we really wanted to have you on our show because we have a choir for persons with aphasia. And one of the burning questions, would be, what exactly is music therapy?
So, according to the Association of Music Therapy Singapore, music therapy is the scientific use of music interventions within a therapeutic relationship towards observable or measurable functional, educational, rehabilitative, or well-being outcomes by a credentialed professional. So simply put, right, it is a triad relationship where music is used as a medium to forge a therapeutic relationship between the patient and a credentialed music therapist to address different goals and objectives. So the goals and objectives can range from physiological problems with maybe walking, talking, memory, to psychological needs such as like low mood, depression, anxiety, and pain. Yeah, that's what music therapy
Hang
is.
on, you're telling me that music therapy can help someone walk? You said physiological, right? How does that work?
Yes. So in music, there's such thing as a rhythm. So rhythm, by pairing rhythm with walking, we can actually help our patients retrain their walking. Yeah, but this is done actually with the physiotherapist just to make sure about our patient safety and all this. And, we come together and talk about how to include the rhythm in specific exercises to help our patients with the walking.
Oh, that's
Yeah,
super cool. Yeah, I
yeah,
mean, that is amazing. And
it's
I've
really
always
fascinating.
heard, this comment like, oh, music is a whole brain activity. What does that mean actually? I mean, like it's a, entire brain thing.
Yes, it's an entire brain thing. So, like, contrary to popular belief, where everyone thinks that music is just a right brain thing, right? But actually, music stimulates the whole brain. Yeah. So, from this picture, you can see that music actually stimulates many various parts of the brain, such as, for example, the prefrontal cortex, which is like here, which helps with expression, helps with language. Yeah, so music itself has like rhythm, has melody that kind of is embedded and is similar to language. So it helps to push that language ability out and retrain speech. So another one is like maybe hippocampus, which is like the memory area. So like, music also is embedded with memories, memories are tied with music, different types of music stimulates different types of memories. So that's where, it triggers this part and helps people to also increase their expression because they want to talk about it. Yeah, so
Yeah, I
there's many
mean,
things going on. Yeah.
it's amazing because I mean, I've seen in clinics how music therapy has really benefited some of our patients with dementia or even Parkinson's, Yeah. So it's really amazing. Yeah.
Yeah. It's very fascinating.
And it says here playing and listening to music works several areas of the brain, right? So how
Yeah.
is music? So does it mean that if I just listen to music, it is like music therapy? Like if I just listen to Spotify, it is considered a form of music therapy?
So that is not music therapy. That's more of like therapeutic music. So it's just music listening. So listening to music is like a passive process. So it's not what we see and look for in a
Ah,
music therapy process. So music therapy sessions are more of like an active process where both the therapist and the patient are actively using music to address and achieve different types of goals and objectives. Yeah, so for example, it's like singing to improve breath support and pronunciation. Yeah, so there is an objective there that
mm,
helps uh, by using music. Yeah, so it's very different from just listening to iPod
okay.
or
I was
Spotify or anything. Yeah.
Yeah, I feel like my memory hasn't been great lately, and I was hoping that listening to Spotify will help me improve my memory. Guess not. Right. Okay. So yeah, I think you also prepared another slide
Mhm.
about misconceptions, right, of
Yes.
music therapy. So I think there must be so many fallacies about this. And what is this meme trying to say?
So this meme is trying to say that there is no such thing as a musical therapist. So we are just music therapists. So I have no idea how did this even come about, like the term musical, because I always thought that musical is like adjective and not really like paired with something else. Yeah, so this is something that this meme totally describes it. Like there is no such thing as a musical therapist. We are always music
I
therapists.
suppose musical could be a noun because like My Fair Lady, Fried Rice Paradise. I mean, musical could be a noun, I guess. But yes,
Can
I get what
also.
you mean. Yeah. So when people say musical therapist, it's wrong lah. So you must tell them, no, I'm sorry, it's called music therapist.
We try to let them down slowly that no, actually we are called music therapist, not musical. Yeah, yeah.
Take it as a compliment. They think you're very musical.
Yeah, that's another way.
And there are more fallacies, yeah, more misconceptions.
Yeah, so the first misconception is that patients need to know music to receive music therapy. So it's not true because patients do not need to know music, like professionally train or all this, because what we are doing in a music therapy session is not to like make sure that you play the music perfectly. We're actually using the music as a tool to help you to address your needs. So patients do not need to know music to receive music therapy. In fact, actually, majority of my patients that I see in the hospital do not have any musical background. Yeah, so it can be just plainly I like to listen to the radio. Yeah,
But would you
that's
say
it.
that an individual who loves music to begin with
Mm-hmm.
would benefit more from music therapy? So I get what you mean. You don't need to know music to
Uh-huh.
benefit from music therapy, but if somebody loves it, would they benefit more from it in your
I,
experience?
I would say that they will be more inclined to trying
Okay.
this therapy. Yeah,
Mm,
because in general, like music therapy is still counted as like a pretty new therapy in Singapore. So people can be a little bit daunted when they hear the term music therapy. They don't know what is happening in a music therapy session. They might think that, oh my God, I need to know music, I need to play something. Yeah. So when people actually genuinely love music, right? They might be more inclined to try to see where this goes. Yeah, so it's definitely a good thing. Yeah.
I bet you get a lot of the I don't sing or 不会唱歌.
Yes, I always get that. Or 我不会，我不要，我不要，不要，不要，不要. Yeah, so
Mm,
yeah, I always get that. It is
mm,
so
mm,
normal, especially with the older adults because
mm,
they see it like, huh, what is this?
mm.
Yeah. So, but then
Yeah.
as long as we actually explain
Mm.
like why we are using music to help them, they are actually quite receptive to like trying and see where this goes.
So is
Yeah.
this where you tell them, it's okay, uncle, it's not classical music. You get to listen to Theresa Tang or songs by the Beatles.
Yes, exactly. Yes, because actually quite a lot of my patients are like, huh, are you going to play like instrument only? Yeah. So another misconception is classical music is the best option for all patients. So this is not true either. Because for us music therapists, we use patient preferred music during sessions. So the reasons are because number one, familiar music induces motivation. So it's something that you know, so you might be inclined to singing or like playing an instrument with it, you know. And two, it's less daunting for the patients to try out new methods.
Mm.
Yeah. So why we use patient preferred is also that lah. And also to encourage autonomy, you know, and sharing, get them to share what are their favorite songs, you know, get them to choose what are their favorite songs. So it actually sparked a lot of like conversation between the therapist and the patient.
Absolutely.
Yeah.
I think that in itself is a empowering process, right? Getting them to
Yes,
actually verbalize their preferences. That's
definitely.
great. And we kind of talked a little bit about that earlier on, right? Music teachers and musicians. No, maybe we talked about the last point. So you can,
Yeah.
yeah,
Yeah. So the
conception,
third
yeah.
point, like music teachers and musicians are also music therapists. So what one difference that makes us very different from music teachers and musicians is that music teachers and musicians are focusing only on musical skills. So for example, like using the right fingering to play on the piano or any other instrument and reading the right notation on the manuscript. Yeah.
Mm.
So, but then on the other hand, music therapies focus on non-musical goals, meaning that we are looking at whether, for example, are you able to grasp the drumstick properly when you play the drum? Are you having a good posture? You're sitting upright. You have good control of your body. Are you swaying? Yeah. So all these are the things that we are looking at instead of just are you playing the right notes? Yeah. So another thing that differs us from music teachers and musicians is that for all music therapy sessions, we follow a therapeutic process. So what is that? It's like we have an assessment, we have a treatment plan, and we have an evaluation. So through assessment, we can determine a patient's like functional and psychosocial emotional needs. Yeah, and then come up with the goals and objectives to help our patients. Yeah, so from there we formulate like individualized plans to address these needs. Yeah, so it's very different from what they do.
Mm.
Yeah.
Okay, and you already explained earlier on about the
Mm.
Spotify. So yes, listening
Yes.
passively to music or the radio is not music therapy. Sorry, guys.
No.
Yeah, we have a question from a Facebook audience.
Oh,
So,
sure.
question from Bryna. This is so interesting. So, what is your training or background to become a music therapist? In fact, you prepared slides on that too.
I
So,
did. Yes.
yeah. So, how to become an MT, which stands for music therapist?
Yes. So to become a music therapist, firstly, you need to be proficient, at least in one instrument. So proficient, I mean that you can play well. Like you don't get stuck when you play. Yeah. So you don't play halfway, then it's like, I can't like, yeah. So you're playing it very well. Yeah, well enough. Yeah. And then that's one criteria to becoming an
Hang on,
MT.
I'm just gonna ask a little bit more. So you have to be
Mm,
proficient in at least one instrument, but I noticed that at least, not just you, but all the other
mm.
music therapists I know, right? You guys can play so many instruments. What's up with that? Like, is there a prereq that you need to know many instruments but be proficient in at least one?
No, actually not. A lot of us actually acquire the skills through music therapy school. So, for example,
Mm.
I can share like my primary instrument actually was a pipa. So it's a Chinese
Wow.
instrument. Yes, it's
Wow.
a totally different instrument. Yeah,
Wow.
and
Okay.
then in music school, I actually started picking up the guitar, and then when I eventually transitioned to music therapy school, I just did use guitar as my primary. And then from there,
Yeah.
I learned how to play the piano, I learned how to play the drums. Yeah, so why you see that a lot of us actually play different types of instruments is because we acquire it along the way and not that before we get into the program, we know how to play all this. Yeah,
Right.
so it will be quite scary if like we have to have all these skills before we go in.
And I
Yeah.
love that you actually, the first instrument that you play
Mm.
professionally is pipa, which is a Chinese orchestra instrument for,
Yes.
for those of us who are not familiar with
Mm.
it, which means I could be, and I don't obviously, but I could be playing the tabla or something and, one aspire to be a music therapist.
Yes, sure. Why not? I mean, like,
Mind
as
blown.
long as you have like some,
Yeah.
yeah, as long
Nice.
as you have some musical background, not saying like professionally trained, but as
Mm.
long as you have some musical background, you are totally eligible to applying for a music therapy program.
Yeah, and
Yeah.
I think you wrote this, right?
Mm.
That it is actually not compulsory to have a degree in music.
Yes, yes. I think it's more important to actually have a good mindset of why you want to be an MT. So like if your passion is to help people using music, that will be one way to decide if you want to become a music therapist or to enter a music therapy program. Yeah, so it's not compulsory to have a professional degree in music, but the intention of becoming a music therapy will be more important. Yeah. Yeah. So all of us actually let me just touch on the points here. Okay. So
Sure,
like
yeah.
all of us actually have to attend a proper music therapy program, which is accredited. So right now we have schools in actually many different countries like US, UK, or Australia, New Zealand. Unfortunately, we don't have a local program. Yeah, so you can either take a 4 years bachelor's program or a 2 years entry level master's program, inclusive of like clinical internships to graduate as a music therapist. Yeah, so there are many outlets.
Yeah.
Yes.
Yeah. So if anyone from NUS or SIT you're listening in, consider setting up a music therapy program, right? Yeah, I mean, because I really see that there's a lot more demand and you are so busy at work, right? Don't you wish
Yeah,
you have
I'm
more
super busy. I wish we
more
can
colleagues?
employ more people. Yes.
Right. Yeah.
Yeah.
Yeah. Oh, so I mean, we have a question which is, how does music therapy help persons with aphasia? And I guess, maybe not just persons with aphasia. We could talk a little bit more about persons with neurological impairment. Since we used to work so closely in the neuro wards as well.
Yes. So maybe I can just touch on the general sense first. So music like from the previous slides that we have, the different parts of the brain is lit up using music. Yeah, so the same thing. Like there are three components of music that are used to help with different patients that have neurological disorders. So like yes, this like so like tonality, rhythm, and lyrics, they are all part of music. And if I want to touch specify straight into like speech wise, right? For any patient with neurological disorder that has speech problems, we can narrow down into this section whereby music and language are very similar. So for example, like tonality, as you can see, is like pitch in speech. Rhythm is like the structure of your speech phrasing in terms of pacing and fluency. And then lyrics is where, you formulate words to put into a sentence. That's also part of speech. Yeah, so in music wise, it has all this in the music to help our patients. Yeah, so like how does this work, right? It's because we are tapping into the intact right brain to use music to bypass the injured brain cells using rhythm, melody, lyrics to retrain the speech. Yeah, so there are many things happening when you are doing music with like maybe speech disabilities in neuro patients. Yeah.
Hence, we hear a lot about, like parents wanting to send kids for, like classes, piano classes and whatnot, right? It's really
Yes.
because of the neural activity, isn't it?
Yes. Apparently, like I read a study before that they did a research, and then they said that musicians actually have bigger brains because they are always actively using it. Yeah.
Now I
They
wish
have
I
a
learned
thicker
something when I
corpus
was younger.
callosum, the link between the two brains. They have a thicker link. Yes, apparently.
I'm not surprised because it takes so much rhythm and coordination to play an instrument well. I tried to learn the ukulele and I'm terrible at it. Like I cannot. So I figured, okay, very poor coordination and whatnot. But yeah, it's amazing. When I see you play, it's like, woo, yeah.
I think it takes years of practice. Yeah, because we are like singing, we're interacting, and then we are trying to play the instruments as well. It's like so many things at one go. Yeah, so it really leads up our whole brain. I mean I have actually mentioned to like our rehab doctors in the hospital that, oh gosh, you guys should like like attach me to like electrodes, see what is happening inside when I'm doing a session.
They've done that before, isn't it? Like they actually fitted patients with open brain surgery.
Yes,
To
they
make sure that
did.
the parts of the brain that's not that actually
Like
controls the
affect.
is affected, right? I
Yes.
mean,
Yes.
I definitely read about it. Yeah.
Yes. Like for Parkinson's patients, like when they go for deep brain stimulation,
Mm,
and if the patient is a musician, they will they will actually do it and ask the patient to play the
mm,
instrument just to make sure that everything is fine.
mm,
Yeah. So
mm.
that's really very interesting. Yeah.
Yeah, yeah.
Yeah.
And because we have worked closely before in clinic,
Yes.
I want to ask you on your take about, what's the most important thing, or what can, guarantee a successful co-treatment with other healthcare professionals, especially at the start. You talked about, helping, working with speech therapists and physical therapists, physiotherapists. Yeah. So what is, really important?
I think the first thing is communication is key.
Mhm.
Like
Right.
what I mean by communication is that we have to communicate our goals and objectives to each
Mm,
other first before we
mm,
even like jump into a session.
mm.
Yeah, so um like we need to discuss what we are trying to achieve. So maybe we are doing different things to but similar goals and objectives. So I think for one, like I can just say an example that we did a co-treatment before, right, Eve, with one
Yeah,
of
we've
our
done quite a few
patients.
actually. Yeah, but
Yes,
there
we
was
have
one
done quite a
memorable
few.
one. There was one
Yes,
particularly memorable one.
yes,
Yeah.
exactly. So the patient, we actually sat down and we talked about what are our goals and objectives. So for the patient, he unfortunately he has aphasia and apraxia, where there's a problem with coordination of his
And
oral
his apraxia
movement.
of speech was
Yes,
very severe. Yeah.
yeah, his apraxia was so bad.
Mm.
So from my part as a music therapist, I'm trying to use rhythm to help him with organizing his movement in his oral skills. Yeah, so I'm doing a lot of rhythmic stuff to match with the speech. So on the other hand, on the Eve is trying to facilitate all the different sentences that we can use functionally for the patient. Yeah, so we are using different methods to achieve the same thing, and actually it
Yeah.
optimized the whole session quite a bit. Yeah, it actually helped to reduce his apraxia and improve it quite a
Had,
lot.
he had very
Yeah.
good outcomes, I remember. At the end of
Yes.
his rehab stay, he really improved a lot.
Yes. Yeah.
Yeah.
So I think what matters the most is actually communication, because if you don't discuss what's going to happen and then you just jump right in, you don't know what is going on, like it's going to be quite disastrous, like not knowing anything from
Yeah.
the other person's perspective. Yeah. So
That's
it's very
right. Yeah.
important.
We're gonna backtrack a little bit because there's a
Yeah,
question from the
sure.
Facebook audience.
Okay.
Question from Eva. How did you get to know about music therapy and what made you want to become a music therapist? So I think it's more of a personal question.
Wow.
Yeah, but yeah.
Yeah. Okay, let me think. How did I get to know about music therapy? Okay, so firstly, I mean, music has always been an essential part of my life. I started learning music when I was 4. Yeah, so I first heard of music therapy when I attended a talk by Dr. Clive Robbins. So he was a music therapy educator who uh, kind of established this Northrop Robbins creative music therapy in New York University. Yeah, so his description of the power of music and its impact on the emotional states of human experience actually really resonated with me. Yeah, and then moreover, music therapy is like a combination of my interests. So it consists of music, medicine, and helping people. Yeah, so I think all with all these reasons and the motivational talk, yes, the very moving speech and the talk, it kind of spurred me to go and find out more about what music therapy is. And I actually attended quite a few conferences just to understand more. Yeah, so from there I actually realized that oh, music actually not only help with your emotional parts, it actually helps with physiological needs as well. And I was really, like you, Eve, I was very, very surprised that it can help with that. Yeah, because I have never thought about it consciously. I've always thought, oh yeah, like people go to gym and then they listen to music and then it helps. But then I don't know why it helps. Yeah. So after going to music therapy school, I actually realized that, oh, this is why it helps.
Yeah.
Yeah, so that's how I got to know about music therapy.
Thank you so much for sharing. I think it's great.
Yeah.
And I love that you didn't just plunge right into it. You actually went
Mm.
to research a bit more. I think the work that we do, it is so important to find out why exactly we're doing it, right?
Yes,
Yeah.
definitely. The
Yeah.
intention is very important. Yeah.
Can you share with us a little bit more about your daily routine as a medical music therapist?
Sure. Could you pull up that picture?
Oh, yeah. This is a picture, by the way, of Michelle in her clinic. She was featured on Straits Times in 2017. Yes, so tell us what you do in oh
Yeah, so
what is this?
this meme actually sums up really nicely about what people think I do. So like my friends think I just sing with kids, play around and like a, like kumbaya thing. And then what society think I do is like, oh, I'm just like a slacker. And then what academics think, yeah, like I'm a hippie. And then what my clients think I do is like, oh, music is like a salvation. And then what I think I do is like that. And what I actually do is carrying my instruments everywhere I go to like give music therapy sessions around the hospital. Yeah, so
So
so back
funny.
yes, it's very apt. This meme is very apt. Yeah,
Okay, but on
and
a more serious note, I mean, and
yes,
we're getting a lot of questions from the audience as well,
yeah.
about. So we have a question about what's the challenge that you face in explaining your role as a music therapist to your patients,
Yes.
and I think you talked. There was a question. There is a question about how
Yeah.
accepting are your patients to music therapy as well.
Yes.
Yeah.
Yeah, I think just now previously mentioned a little bit about that already. Like because music therapy is still
Mm,
considered quite new in Singapore.
mm, mm,
So a lot of them would initially like reject it.
mm,
Yeah, because they don't know what it is, because
mm,
they haven't really heard of, or some might have heard of it, but they don't know exactly what it is. Yeah, so this is the,
mm,
I mean, is like an everyday challenge that I have,
mm,
that
mm,
I have to explain to them what is music therapy and
mm,
how is the music going to help them. So I
mm,
found out that like over the years, right, by explaining the purpose of the music in very tangible terms, like singing to help with your breathing, or like you're playing instrument to help with your strength, to build strength. Yeah, all these concepts can help our patients who are referred to music therapy to grasp the concept of music therapy better.
mm,
Yeah, so
mm.
it helps to give them that, oh, okay, so this actually helps me. Okay, how about we try it? Yeah,
Yeah.
so they might still be a little bit skeptical, but they are not like closed off to trying. They might be a bit more open. Yeah, so
Right.
I realized that explaining it well actually helps in a lot of things.
Mm.
Yeah, so this is one of the main challenges that I have
Yeah.
like on a daily basis.
Yeah. Yeah.
Yeah.
And that answers a question about what are the challenges in explaining to your clients what you do.
Yes.
So in the hospital, do you only see them as inpatient, or and like, or is it outpatient as well? Can somebody just rock up to the hospital and say, hey, I want music therapy? Can
Okay, so right now in SGH we see inpatient and outpatient. Yeah, just that because we do not have a lot of music therapists right now in SGH, so the outpatient services are like an ad hoc basis, but the inpatient services are ongoing, like as usual. Yeah,
mm,
so for all patients they are referred by doctors, so
mm,
there's an official referral by the doctor to refer them to music therapy. For outpatient wise, if they are from a different hospital, they can also get their doctors to refer them to music therapy. Yeah, so we have actually quite a few inquiries from like maybe Tan Tock Seng, and they want to uh have music therapy sessions because they don't have it there. So they actually got their doctors to refer them to music therapy in SGH. Yeah.
right, right.
So that's one way that you can do.
Mm,
We just need a doctor's memo, yeah,
right.
or an official letter to get the referral.
Right. Can you
Yeah.
share a little bit? This is going to get a bit more technical and nitty-gritty, but how is it
Okay.
different? Because I saw from your profile, I mean, you have such an accomplished CV and you work across different medical disciplines, right? How is it different working with a patient or a client from neuro and maybe neurosurgery versus working with someone from palliative care or intensive care even?
Mm. Yeah, so I think the main difference is the goals and objectives.
Hmm.
Yeah, so for neuro patients, the mostly I see is for functional needs. So like
Hmm.
maybe to help retrain their walking, their talking, or to help them to cope with their emotions. So like regulating their mood in the hospital stay, yeah, or like helping them to alleviate their depression, anxiety, pain that comes with their physical pain and physical disabilities. Yeah, so that's one thing. But for palliative care, is a whole new different goals and objectives. So for that, most of the goals are mainly for pain management or end of life, anxiety, all this. So it's very different. It's more of a psychosocial, psycho-emotional based kind of needs. So what we do in the music therapy session will be quite different. Yeah, so there is a lot of improvisation, you know, where I use music to match to maybe their anxiety or pain levels. So for example, if they are really very pain in so much pain, or they are very anxious, I wouldn't play a very slow music because it does not validate where they are at that moment. I would actually play really fast music. You know, I'll alter it to match where they are, and then slowly reduce the speed, reduce the dynamics to help them to calm down. So this process also helps them to understand, why am I experiencing so much pain? Where is this anxiety coming from? You know, and from there we can actually explore and talk about it. Yeah, so this is one. And then for ICU patients, for example, also different goal. So that's more for like anxiety based, because or low mood, because some of them might be on ventilators, and the doctors want them to wean off the ventilator. So that causes a lot of anxiety. So my role is to help to alleviate the anxiety and help them to retrain how to breathe properly again, by using like maybe not singing, because they are not at that position to sing yet. It's more of like just breathing, learning how to, you know, breathe properly in and out, you know, diaphragmatic breathing. Yeah, so it's just basic components before we build up from there. Yeah, so I think the main difference is the goals of why we are seeing all these patients.
We're
Yeah,
getting a lot of questions from the Facebook audience, and
sure.
thanks for asking that. And it's actually very linked to your work as a MT in a hospital. So a
Yes.
question that you have actually touched on is a question from Bryna again. Under what circumstance will music therapy be prescribed by the doctor?
Right. I would say that it stems from like what the doctors know of music therapy. So it encompasses a lot of education from our part, like educating the doctors like why music therapy is needed, or how, like which instances music therapy is needed, or like when music therapy can be administered. Yeah, so there are many different reasons for that. So but it based on like how we educate our doctors to have the awareness of what music therapy can do before they can refer the patients. Yeah, so right now we actually have quite a good uh how do you say, advocacy in SGH. Yeah, so many of the doctors actually know like how to refer, like the standard criteria to refer to music therapy. So for one, for example, number one, the patient likes music. That is awesome. Yeah, so second, whether is there anything that they think that it would help them, like music therapy will help them. So for example, are they experiencing very low mood, are they depressed, you know, do they have any problems with their functional disabilities? So these are the areas that they can explore from the doctor's point of view. And if they're medically stable. Yeah, so I want to touch on like just briefly, like medically stable, meaning that like they are not like in critical condition, because as much as I would like to advocate for music therapy and music itself, music also can have adverse effects, like, you know, if I play too much or sing too much, it might affect or jeopardize their vitals. Yeah, so I want to make sure that they are not too critical. Yeah.
Right. Thanks for sharing that. And a question from our Facebook audience, Vic.
Sure.
Have you got any experience seeing patients with severe apraxia of speech? Yes.
Yes, many,
Lots.
many, 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 many.
Yeah.
Yes, I've lost count of how many patients I've seen with severe apraxia and aphasia. Yeah, it's a lot of patients, and it's very interesting to work with all of them, because although all of them are like, although they are having severe, but like they have different spectrums of severity.
Yeah,
Yeah.
absolutely.
So
Absolutely,
so
yeah.
yes, I definitely see them actually on a daily basis. Yes.
Yes, and I think, Vic might have missed the earlier slide, but there was this
Oh, okay,
slide that
okay.
Michelle talked about. Yeah, we're not going to rehash it, but I'm just
Yes.
going to flash it for a second before we move
Yes.
on. Yeah, but we're going to talk a little bit more about your
Oh,
volunteer work
oh
because
my
this is
God.
this is something that is so
Yes.
vital to us, and we are so indebted and grateful to you, starting up our Aphasia SG choir. Yeah, I so do you wanna share about what we do at the choir actually?
Okay, so this choir, I think when we co-founded it was to provide the support first to people with aphasia who likes to sing as a hobby, and also to work on their speech. Yeah, so different parts of speech, like maybe breath control, pronunciation, pacing, everything basically. Yeah, so why we did that is that the reason why.
Yeah,
Yeah, and I think it's been 1 year already since we started
yeah,
the choir, and
more
it has
than
been
actually.
awesome, like
Yeah, yeah,
beyond awesome. Yeah,
that's what
so one
relieved
thing that
me.
we do for every session is that we first start off with vocal warm-ups. It's very crucial. It's a very crucial part of the Aphasia SG choir because it helps to prime our vocal cords and oral muscles before singing. Yeah, so we can't just possibly go into singing. It's like you start a car and you drive straight, you know. Yeah, but you didn't let the car like sit for a while before
Ah,
driving, and it creates more problems. Yeah, so by having the warm-ups, it helps to prime, our voice, our muscles and everything before, oh, we are ready to go,
yeah.
which is like to singing. Yeah, so we do a lot of vocal
We
warm-ups,
have a
like
video of that.
yes,
Yeah,
yes,
let me
yes.
let me flip it to that. Oh, so this is our choir. It's more than a year already.
Yes, it's
Yeah,
what I hear.
yeah. It's just that we used to have it on site, physical rehearsals,
Yes,
but
yes.
now it's online. So now it's
Online.
a virtual choir. But
Yes.
yes, let me flip to the vocal warm-ups.
Yes. Yes.
It's great. It's great. I think we spend
Yeah.
how much time do you usually allocate to just doing the vocal warm-ups?
I think maybe like 15 to 20 minutes. Sometimes it might drag to 25, but it's good because it helps to warm them up. Yeah, so we don't mind like allocating more time towards to the vocal
Mm,
warm-ups before we start singing. Yeah.
yeah.
So like just now, what I was doing was actually singing wow on different pitching. So the purpose of this exercise is actually to help them to relax
Mm,
and expand their oral muscles here. So it's like the
mm.
cheeks, the jaw, the lips. Yeah. So and it's to create as you can see, because we are singing in different pitches. So it helps them to also control their breathing while they attain that pitch. Yeah. So it's a lot of coordination in that sense as well. Yeah.
Fantastic. I'm gonna show another footage. This one,
Oh.
yeah, so
Ooh.
you can see we're all decked up in the choir uniform.
Yes.
This is my beautiful day. When you say that you love me. Oh, my beautiful day.
It's really great. I think
Yes.
many people didn't think that a virtual choir was
Mhm.
going to be possible, but it is. I think we really had the will to just make it work lah.
Yes,
Yeah,
that's very
yeah.
true.
But
Yeah.
let's take a look at some of the footage. I think before we went virtual, I mean, obviously it was on site. So
Yeah.
let's take a look. Yeah, yeah. So before
That was
COVID, before the whole thing.
yes.
Hey, yeah. such good times there.
Yeah, such good
Yeah.
times. I wish that we can go
Okay.
back to this.
Okay, fingers crossed, fingers crossed.
Yes,
Yeah,
yes. Yeah,
maybe phase 3 is coming soon. I
hopefully.
think, you know, this slide that we put up, that you put up, you
Mhm.
know, about musical milestones, you know,
Mm.
what's one of the biggest take back for you, you know, volunteering for Aphasia SG?
I think it's knowing that they are actually improving through singing, like and bonding.
Yeah.
I think that is the most important like take back that I have. Like I see them growing as individuals and as a group.
Mm,
Like
mm.
initially when we started this choir, everyone was just singing to themselves. Like they were so quiet, so shy. And then they was like just mumbling. They were literally mumbling through the songs. But as the time progressed, you know, they started to open up. You see different personalities shining. You know, they form groups. They are a huge group, and then they form like cliques to go home. They form like cliques to sing. Yeah, so it's like it's really very nice and very, very heartwarming to see all of them like interacting with one another. Yes, yeah. So
Look
yeah,
at
some of them
this.
became best buds. Like yeah, so you can see that all of them want to be in this. You
Mm,
know, like
yeah,
they want to improve together. They want to sing
yeah.
together, and I
Isn't it
like it
great?
when like
Yeah,
yeah, I like it when all of them are just helping one another. You know,
yeah,
especially for this performance. You know, like some of them would help to hold the scores, some of them would help to stage the plays, you know, put the
yeah,
stand and all these things. So
yeah. It's
it's
great.
like
Yeah,
whoa, it's like a whole new support group for all
yeah.
of them.
Yeah, it's
Yeah.
fantastic. There's actually a comment from one of our choir members who's also
Oh,
part of the Facebook audience. So
oh
Mr.
my god.
Kikun actually wrote, I benefited from music therapy from the choir. I can now whistle like I used to before I
Mm,
had my stroke and aphasia in 2017. Yeah, thanks for the testimony and positive, I mean, and the affirmation.
yeah,
Yeah,
of course. Thank you, Uncle Kikun.
yeah.
Miss you.
And really, I think we have spent so many really milestones, I think dates as well. So
Yeah,
make a guess, when was this? I mean,
many.
audience, you all make a guess. It's obviously, it's so obvious, isn't it? We spent, you know, so many festive, you know, seasons together, Christmas, New Year.
Yeah.
This was them performing at the Christmas Chit Chat.
Yeah. Yeah.
I remember this session. You were
I was
doing the
conduct.
queuing. You were doing the visual
Yeah.
prompts in front. Yeah, I
Yes,
remember.
yes. Was it their first performance? I can't even
No,
remember.
no,
Like,
this wasn't their first
like
performance.
first.
Yeah,
No. Okay.
they were getting really. I remember the first time they got on
They
stage,
were
they were so
super.
nervous, but then after that, like
Yes.
wow, like a pro, man.
Yeah,
Yeah,
they were so psyched out. It's so
we spent
amazing.
National Day together this year.
Oh yes.
This is my dream. This is my plan. This is my future. This is my life. This is my family. These are my friends. We are singing our own. Sing our glories. We are singing our own. Sing our glorious.
I tell you, I love our choir.
Yeah.
You know, everyone is so game. You
Yes.
ask them to come in
They're
red color, they'll
super.
come in red, right? I love it.
Yeah.
I love
They're
it.
super
Yeah.
game. They're
So
just
we
willing to try everything.
Yeah, and oh, so this is our logo,
Oh yeah.
which is also
Oh, I'm
designed
wearing
by.
it.
Yes, yes, you're wearing
So
it.
Aphasia
Our Beja
choir.
Yeah, yeah,
Oh
our
yeah, there.
uniform. Fantastic. Oh, so don't just hear it from us, lah. Hear it from one of our choir members about why he enjoys joining us.
Welcome to Aphasia Choir.
I like to come at East Asian Choir because I love to sing.
You love
Don't you just love this stuff? It's so
Yes.
awesome. Really
So
miss,
cute.
really miss everyone. I mean, so much. Really miss
Yeah,
everyone. Yeah.
really.
Okay.
Miss
Questions are coming
them.
fast and furious.
Sure, go
Um,
ahead.
okay, so there's a question from Bryna. When do you guys plan to restart face-to-face practice? I really hope you guys get to perform soon. I think this one I can take it from Michelle
Yes,
because we
go.
we absolutely have no control over this.
Mm,
It very much depends on I think government like directives lah.
yes.
We are working with a population that is considered somewhat vulnerable because of the brain injury. So we are not sure. We hope to restart, but we're not sure. There's a question from Renette. I hope I'm pronouncing your name right. Is there a channel for people who don't have official training in music therapy, in MT, to volunteer with or as a music therapist? Okay. So I
Uh,
guess the question is, yeah, if you don't have official training in MT, can you still volunteer as a MT?
So you can only, unfortunately, you can only volunteer as a music volunteer. Yeah, so as I've mentioned earlier, like all music therapists have to go through an accredited program to certify themselves as a music therapist. So we have to go through music therapy school and learn about how to use music, the applications of music. So we are not just performing. Yeah, we're actually using it for a purpose.
Right.
Yeah, so without that background, it'll be quite difficult to be like a music therapy volunteer. Yeah, we are considered a music therapy volunteer for our aphasia choir because we are music therapists and we are trained in music therapy. Yeah, but I think it would be better if you can start from maybe being a music volunteer to
Mm.
see especially you can kind of volunteer for our choir as well. I mean, why not? Yeah, so you can see how we do things, how we conduct our sessions, and then maybe you can kind of see whether this is what you want to do. Yeah,
Yeah,
in
I
terms of
have the
music
perfect
therapy.
slide for that. I have the perfect slide
Yeah,
for that. If you,
yeah,
so yeah, the perfect slide for that is this. Yeah,
yes,
if you are
correct.
keen to volunteer or to find out more, scan the QR code and you will
Mm.
actually get to a Google form where you can sign up. As yourself as a volunteer, or if you know you have a loved one or you know someone who has
Mm.
aphasia or apraxia of speech, tell them about our choir. Inside this form, you will see not just the choir, but other programs that Aphasia SG runs. So you will see Chit Chat Cafe. You will also see our upcoming befriending program. And when do we have our choir? It's every second and fourth Tuesday of the month from
Mm-hmm.
8 to 9 o'clock. So this is the virtual version, the virtual choir.
Right.
Yeah, and I'm mindful of the time. I know that we are almost coming to the end, but we still have time for maybe a few more questions. And
Mm-hmm.
we're getting one more question from Atina. What are the challenges you face when the Aphasia SG choir turned virtual?
Um, I think one of it is that we are unable to see them face to face.
Mm,
So I can't eye contact with all of them as I want to when I was doing physical sessions because I can't see all of them on the screen. Yeah, that's one of them. And then the second one is the audio. Yeah, so we actually had to tweak around with the audio system via Zoom, like to see what actually makes it work, like whether they hear us, can they hear the instruments? Yeah, so that's one of it. And then we also have to get used to the fact that when we are singing, it's kind of like a lapse in a way when we are hearing it from our side. Yeah, so as you can hear from the video when we were singing the song of Beautiful Sunday, it was a little bit lapsed, but actually we are all together. It's just that what they are receiving and what we are hearing is a bit different.
mm,
Yeah, but actually we are not like out of sync totally. It's just the way that Zoom works. Yeah,
mm.
so these are the few problems that we face initially. I mean, we try to like adapt to it over the sessions. And also, oh, one more thing is teaching the choir members how to use Zoom. Yes, that is one challenging thing. I mean, they are really very on trying all kinds of things. So they really learn how to use it. It's just that wow, the perseverance of learning it. Also, we have to teach them, remind them what to do. Remind through text, how when to come on and all these things. Yeah. So, but then I think we are all getting the hang of it because it's been so many months already, and yeah, so it's just about adaptability lah, I guess.
Mm. And interestingly, because it used to be on site, and the traveling, the commuting was a problem for some of our members. But now with virtual, we are actually getting a new group of participants as well. Those who are willing to just flip on the computer and join in. So well, I mean, you win a little, you lose a little. But overall, I think it's been great. Yeah.
Yes.
Great. Yeah. I mean, Michelle, once again, thank you so much, for joining us this evening, and really for all the time and effort that you have invested into, our little like ground up movement that has grown so much, and you have played such a pivotal role in starting the choir. So thank you so much, and obviously to all our music therapists, volunteers. Thank you all so much. We are eternally indebted. I'm going to share what we are doing next week. Episode 5, we are featuring our social worker volunteer, Carmen Look. Carmen still, helps out with the caregiver component of things. And she is somebody that you want to like ask questions about, social work and the scene in Singapore. She knows so much, and I've learned so much from her. So tune in if you are interested to find out about social work in the community, in a hospital setting, because she's done it all. Fantastic individual. And thank you all so much for tuning in. See you all next week. Thanks for tuning in to Connecting the Dots. Thank you, Michelle.
Thank you for having me.
Bye, everyone.
Bye. Thank you.